Hi, this is Junaid. In the last few sections, we discussed about how change has changed, how Industry 4.0 is going to translate into Healthcare 4.0. And then we looked at digital transformation, what it really means in healthcare. Now we're going to talk about the impact of pandemic on the digital transformation in general and medicine in specific. Now, pandemic is a very bad situation that we all had to live through. This is once in a century event, but we are probably going to see the reverberating impact of this particular pandemic for the next 100 years. The only silver lining is that how it brought the limelight to digital transformation of healthcare as the urgent need of the time. There's a famous quote by Lenin: there are decades where nothing happens, and there are weeks where decades happen. Very interesting, and unfortunately, the transformation that we are going to see due to pandemic is the catalyst that, to be honest with you, we all needed, especially in terms of healthcare. It unearths significant inefficiencies and inequalities in the healthcare system in general, which will bring about significant trends of future of healthcare. Number one is reform. We have already seen openness to reimburse virtual care. We have seen equity as one of the key essential portion as healthcare for all. We're going to see a significant expansion of healthcare technologies, including artificial intelligence, virtual care as we see, and other health IoT services. We're going to see another next generation of managed care acceleration in which capitation rates are going to be there. We're going to truly reimburse value as compared to activity or fee-for-service models. And we're going to disassemble the disorganized, decentralized way of doing things. Rather than this fragmentation is going to be replaced by integration. It doesn't necessarily mean centralization, it means integration. So most of the different portions of healthcare that are now disorganized, disintegrated, are now going to be integrated in a way that all the data is assimilated for the care of the patient. Now, this is not just for healthcare, right? I mean, digitization in general got a quantum leap forward just because of the pandemic itself. The contactless care significantly evolved, and as simple as swiping a credit card was changed by NFC, payment systems. We have seen that a significant shift in digitization has already occurred. The e-commerce, of course, is one of those categories that got a significant boom. 10 years of e-commerce that would have taken 10 years to get there only happened in 8 weeks. Telemedicine, 10-time explosion in 15 days. Remote working is significantly, now, to be honest with you, remote working is now considered the norm as compared to previously. As a matter of fact, if you look at the new updates from Google Calendar, it actually states that home as a place of work, as you could choose, different office locations on your calendar, you can choose home as one of the locations. That's significant change. That literally the calendars itself, the infrastructure of calendars are being updated to include this significant change. Remote learning has already been getting accelerated, MOOC models, and now it's going to be even further. And of course, online entertainment, everything is moving towards streaming and online, including education and entertainment, as you can see right now, looking my lecture over YouTube or different platforms online. Now, the biggest change has been the willingness of the customer to interact. That is where the key cultural mindset shift is. This is where the behavioral change is, which is the hardest thing to change. When the customer itself is interacting with you digitally more and more, that is where the real shift comes in, because the minute they start interaction by default via digital means, that's where the true change comes in. And we have seen that significantly, especially in North America and also globally as well. So the interactions between customers and industry is becoming increasingly digital, which is, again, a behavioral shift that sometimes take decades to make. The largest leap always happens in the services that have already been digital. For example, Amazon, eBay, etc. Those are the companies that benefited most, including me. I could work for a telemedicine company. We saw an explosion like no other just because of the COVID. It's bad, but unfortunately, in times, those companies that are already digital, I have been working remote before COVID for 2 years, providing telestroke care. For me, those already services, those learning that I already had before the COVID significantly improved my career progress just because I was more prepared for it. Similarly, those companies that were more prepared in the digital era had the most amount of gain in that process. This turned out to be a significant mindset. There was one mindset that I talked about, the consumer mindset. The other mindset is the executive mindset. So, hospital systems initially were not akin to turning into virtual care. Now, hospital systems are calling by the dozens to companies like VMed and others that, we need a virtual care strategy. This mindset at the executive level is amazing to see. And this mind shift that has happened today is not going to go away. It's going to continue. The vigor may be different, the challenges may be different, the pathways of implementation can change from 100 times to 1x, whatever that may be. The capacity and the velocity of change may be changed according to the times and financial availability, but the mindset is there. This is not going to go away. The digitization now has become a priority in executive minds. And this is the new normal, right? I mean, you work from home, you learn from home, your communication and information infrastructure is built at home. Shopping and consumption is already there. I mean, I get groceries from Amazon Fresh, Walmart delivery, etc. Life is at home, and play and entertainment clearly has been with, a massive explosion of online education, online entertainment, and online gaming. And clearly, we're going to see that health and well-being is going to continue to be more digital and potentially more so from home. And we're going to talk about this a lot more when we move forward. Again, all these references, resources are available on the website. Please check back again for updates, because I'm going to regularly update with new data and new information. If you save a life, it is as if you saved the life of mankind. Please make sure you like, comment, share, and subscribe to my YouTube channel and my newsletter. If you want to get in touch with me, the best way is to go through Twitter or via LinkedIn. Also, make sure you follow the Academy website for regular updates. Thank you so much.